this is what we call a charcoal foot with that collapsed foot. And so you actually had the bump shaved off, huh?
Yeah.
But this one hasn't been bothering you as much on this foot?
Sometimes, but not that often.
And so when was the last time you had these ones changed or done, these orthotics? And
Oh, yeah, I gotta go.
2 or 3 years.
Yeah, I gotta probably go see him.
Yeah, I would say just do that just to keep everything fresh, just to give as much padding support as possible.
So again,
Re-broke it.
yes,
You
I
remember the
bent
same
it.
one?
I bent it.
Broke the, yeah.
Just from sitting there?
Yeah, because my bones are so weak.
Oh.
So I drove myself to the hospital. Wow, this one's calling me.
Were you downtown?
Yeah,
You're crazy.
and I drove all the way to Scarborough, Scarborough General, because I was coming home anyways.
So you are tough,
Yeah.
to say the least.
And then the second time, I don't know when I broke it, but the final draw was I was in the living room. I stood up to go to the bathroom. It was aching me at the time, but I thought it was just my arthritis. I stood up to go to the bathroom and I couldn't stand, so my husband said, "Okay, time for you to go to the hospital. We can't even move." So I don't know how long I was walking on a broken
Oh
femur.
my. So removing that other toenail, I think you're gonna be fine.
Yeah.
But this is the one thing. Let's
Yeah.
try the conservative
Yeah.
first,
Yeah.
and then see how you feel, and how long it lasts.
Yeah,
Okay.
sounds good.
So what we're gonna do is trim all the nails, get them as short as we can, and then we'll file down that other one that's been bothering you,
Okay.
and we'll go from there. So you just relax the feet.
Yeah.
So, well, I guess with everything you got an extremely high pain threshold, huh?
Yeah. Yeah, I still have lots of surgeries to go through. I've had 26 so far.
Wow, well, you are tough. How old are your boys now?
One will be 18 in November, and the younger one is 15.
Still young.
Yeah.
So how would you normally take care of the nails? Would Gord help out, or?
Sometimes, my regular, but he works on a Saturday. But Saturdays for me they're kind of busy
Mm-hmm.
because I go to singing classes and then I go see my dad in the evening, so it's kind of hard for me to see him.
This is a foot specialist?
Yeah.
And have you talked about the removal with him?
No, because I haven't really got the chance to talk to him.
We haven't been to see him for a long time.
Yeah.
A couple of years, right?
Yeah.
A couple of years, okay. And so when do you think the last time these nails were cut?
He did it last
Yeah, but that's probably
about a year.
maybe a year. 6 months at least. Somewhere between a year and 6 months.
So that's why I think the way we're gonna file down the big ones
Mm-hmm.
will really, really take a long time.
Okay.
And just to let you know, so if you're ready for that possible downtime and really watching the toes and making sure you're taking it easy for maybe even 2 weeks, that would be the time that we can do the permanent procedure on that left toe.
Okay.
And then again, I would still just clear with the doctor and see how you feel after this, because if it lasts 6 months to a year,
Yeah.
sometimes it's better just to avoid the procedure and less trauma to the body, and we just clean it up once a year.
Yeah.
Yeah, I think she just needs to make more regular trips to get trimmed and stuff.
Yeah, but after a while you get sick of seeing doctors.
I know you do. I know. So that's why we'll try it this time. And like I said, if we really
Yeah.
want to go for the permanent, we just go for the family doctor, see if what maybe a different type of medication they put you on, a
Yeah.
strong antibiotic before, just to prevent any sort of infection. And we take it easy that week just to really
Yeah.
allow it to heal well.
Yeah. Because when I go to the dentist, I have to take 4 tablets of antibiotic. Like when I go get my mouth cleaned.
And it'd probably be the same kind of idea.
Yeah. So do you have kids?
No
No?
kids.
You're too busy?
Busy working. Busy practicing. No kids. But we do want kids, so it's just
Yeah.
a matter of, waiting a little bit. We'll see. My dad was really, really busy when I was growing up,
Oh,
so
okay.
I don't want to be like that. I want to have,
Listen that.
I want to have a little bit more time.
Yeah. I saw in your latest video that you're taking some time off, like Mondays and stuff.
Yep, still not yet. This is still Monday. This is my last Monday.
Yeah.
Yeah, so. But other than that, I'll still be 5 days a week. I'll be Tuesday to Saturday.
Yeah.
Obviously, because this nail is so high, that's what's giving you so much issue. When you would see other foot specialists, would they file the nail down as well, or just trim it?
Just trim it.
So this is going to be the big thing. Trimming the nails, filing the nails is what's really going to allow you to get more relief.
Oh, okay.
Because we're basically going to file it down to the nail bed,
Oh, okay.
and it'll be completely flat. So you had both big toes fused
Yeah.
and baby toes?
Yeah.
And why is that? Was it to give you more stability, or?
No, they were curving. They
Okay.
were getting all wonky. So my dad went with me and I said, "Are you sure you want to watch?" Because when they pulled it out, it was as long as from the tip of my toe to the back of my heel. And he almost fainted.
Oh, when they pulled the wire out?
Yeah, the long nail.
Yeah. Oh, yeah.
Yeah.
How was that? Was that pretty painful?
No. No.
And have you seen a difference after that procedure?
Yeah.
Has it helped?
Yes, but on the X-rays now, it's moving. It's getting all weird inside, so he doesn't want to do anything. I see a specialist for my feet. He already took off a bulge underneath that foot, and I have one on the right foot at the side, but he doesn't really want to do anything because it's a lot of nerves.
And when did you first get those bumps on the bottom of the foot? How long ago?
A long time, like 6 years ago. Like it just kept growing and growing. It wasn't as big, but in time it grew. And when I wasn't really walking on the bottom of my feet, I was walking on top of the bump underneath my foot, so it's starting to get irritated.
And do you remember when they started? Was your foot getting really hot and warm when those bumps were starting? Like, did you notice like a big change one day, or was it just little by little it changed?
Just a little by little.
So you can see these nails were so long, right? That's pretty much the full year of growth, probably.
Okay.
So if you were to do 6 months, I think you'd be more than fine.
Yeah, we're good.
And then when you get tired of seeing me, and then you just say, take it off.
Yeah.
So we'll do this one nice and easy.
Yeah, it's fine.
And you said this was the one that was removed before.
I'm not sure. I don't really remember which one.
And where did they remove it? In a hospital?
No, right in this chair. Without anesthetic. Like it was already coming off.
Oh, did he just trim it back or pull it off?
He pulled it off.
And was there blood?
No, it was pus.
Oh, jeez.
It was infected, right? So it was just hanging on, so he just
Does
removed
it did that?
Yeah.
So trauma like that, ripping off toenails and getting them really infected and them falling off really damages them, and that's why they normally grow back thick like this. A little sore here?
No,
So if anything gets a little sensitive, you let me know.
I don't know.
So we're gonna take this off layer by layer.
I think that was the one last time I trimmed that was kind of ingrown
Yeah.
on the inside there.
No pain?
No.
Yeah, the nail bed is completely lifted. And that's why we have all this dead skin underneath it, and that's what's causing the nail to grow
Up.
Yeah. So I always like to try to get as much off as I can with the nail nipper and then file everything down.
Okay.
And we'll see how far this can go, because... Sore here?
No? I'll let you know.
Oh, you got a good kick hiding, waiting for me, huh?
Uh-uh.
Okay, let me file. We'll put the feet down, file them. I'm just gonna roll this back, okay?
So how's your dad doing?
Oh, that's nice of you to ask. He's doing well.
Yeah.
He's hiding.
Saw you and him on Dr. Oz.
Yeah.
Was that taped or?
Taped.
Yeah.
It was taped. So we went down to New York. That's where they film, and yeah, they threw me on the show, and I had to get ready. Yeah. It was pretty nerve-wracking. I was extremely nervous.
Yeah?
Yes.
You didn't look it.
Oh no, I was extremely nervous. I was freaking out in front of everyone, live audience. It's nerve-wracking, but I didn't have a choice. The inside John, I didn't want to do it because I was too nervous, but I had to. It was for the best.
Do you still go to the States? No?
No,
Okay.
no, I can't practice in the States,
Oh.
so I'm stuck here.
Okay.
So what I'm going to do is just file everything down. You're going to see a little bit of cool water. If
Okay.
anything hurts or you feel too much heat, you let me know.
Okay. Get a vacuum machine to feel it?
No. Do you have to wear that or have that at home?
Yes.
Sometimes?
Yeah. Get a full nose, and then, right.
What was that, the back of the heel?
Yeah. Yeah, the guy who put on the cast in his tighten up. So every time I rub it down.
Right.
Okay.
Was that cast for after you got for the fusion?
No, that was for taking off the bump, and then you could
Oh, right.
but
Okay, got it.
yeah.
Who did the fusion? So Daniel too? Or
Yes.
Oh, Daniel did that,
Oh
huh?
no, it was
English?
either him or Dr. Sewell. Might be English. Dr. English.
Oh, really long
Yeah.
time.
Yeah. Yeah, that was
Daniel's is the one that took the bump out.
yeah.
He's a pretty famous doctor,
Yeah.
foot surgeon, or orthopedic surgeon.
Yeah. He's funny because I took Gord to meet him, and then Gord was just sitting there, and he didn't even say hi or anything. He just looked at him, and
Yeah,
So you can see, there's a lot of
Yeah.
darkness, black or red,
Yeah.
and that's all just a bruise.
oh.
So this is a big thing. Normally, when we have really good blood supply, I would have no problem removing a big toe. But this, for your case, man, I'd want to be really careful
Yeah.
and see if this gives you relief. Because if you just have to do this once or twice a year, we do that until it's really, you're really fed up with it.
Okay.
Because no one's really filed this before.
No. No, like you.
You see that? It's really flat. It's really not... Come on, young guy. Come on, young guy. So the red spots on the sides, just bruising
Oh, yeah.
or dry blood from too much pressure, because it was
Okay.
obviously the nail was hitting against
Yeah.
the shoe.
Yeah.
So now that it's pretty much flat, it's going to feel much better, and it's going to take a long time to get as thick as it was. So even if you were to do this again in 6 months, I don't think it's going to be too high.
Okay.
Okay?
Yeah.
Then you do that again, and then you keep going until you say, John, I want that nail off.
Okay.
Okay?
That's good.
Let me file this one down
Yeah.
and go from there. But no wounds, no nothing hiding underneath the nail as well.
Okay.
So we don't have to worry about some sort of abscess hiding underneath there. So we'll take one last look at the nails. I'll do one last little video, and that's about it. So we can see nails look pretty good. And that big bump is down and flat, so lots of bruising on the side. So that's going to continue to dry up and come off with time. So the next time those nails get filed down, that should come off. So for us, I know I'm far away, but if you come here or someone else, 6 months,
Okay.
and we do that again. So we'll just take a look at the bump. So this is a what we call a charcoal foot with that collapsed foot, and so you actually had the bump shaved off, huh?
Yeah,
Yeah.
yeah.
But this one hasn't been bothering you as much on this foot.
Sometimes, but not that often.
And so when was the last time you had these ones changed or done these orthotics? And
Quite a while.
Oh yeah, I gotta go.
2 or 3 years.
Yeah, I gotta probably go see him.
yeah, I would say just